So this is your post-procedure aftercare. In your post-procedure pack, you've got a pack like this, you've got the foam, and then you've also got your post-procedure guide. Now, your post-procedure guide is laid out, so days 1 to 3, 3 to 10, day 10 plus. The most important thing after the procedure is to imagine you've got a big box on your head. So you want to be really careful when getting into cars, anything like that. Don't bump your head. So bending with your knees like this, you don't want to be bending down like this because you don't want your blood pressure to rise or blood flow to go to your scalp, which could cause more bleeding or the grafts to pop. So just nice and easy. So at the end of the procedure, you'll have one of these blue caps on. When you get home, take that off. Don't leave it on because it could get stuck to the grafts. So take that off. The best thing to do for the first 3 days is just to have nothing on. If you do need to leave the house for any reason, just pop this blue cap on really loosely, just because to protect the new grafts from like pollution and the environment and dust and things like that. But when you're at home, you're fine to take it off. And on day 4, you can wear a cap. You just need to make sure you've got it on really loose. With a cap as well, you definitely need to make sure you're wearing one for the first 3 months after the procedure, especially in Australia with the strong UV rays. You want to make sure you're protecting those grafts from any sort of sun damage. The bandage at the back of your head, that stays on for 24 hours. So say, for example, if you had the bandage put on at 5 p.m. on the Tuesday, you would take it off at 5 p.m. on the Wednesday. Now you get saline spray here. The best way to take the bandage off, it will be a little bit stuck because of the antibiotic cream. So say this is the bandage. As you're peeling off, just spray as you go, and that'll make it come off a lot easier. And then you can just spray some of this gauze with the saline and then just wipe off any excess cream. Then just leave it. These blue sheets you can use to put on your pillowcase just to protect your pillowcase. So that's the bandage at the back. Now, the saline spray, everything's labeled to make it a bit easier. The saline spray, you want to be spraying every 30 minutes on the first day. And then after that, for the following 3 days, just spray every 2 hours. You don't need to spray while you're asleep, just spray before you go to bed. Not as vigorously as we spray during the procedure, just a little spritz over the grafts. The cleansing foam, so you use this from day 1. So day 1 is the day after the procedure. So this is a panthenol foam. It's got lots of vitamins and hydrating properties and helps to clean the area. So you're going to use this from day 1 to day 10. Again, it is on the label to make life a bit easier. The best way to use this is if you pop it all over the grafts, leave for 10 minutes, and then spray off with the saline. So just spritz it off. If anything runs down your face, just dab it off with either a towel or the gauze. You don't want to be rubbing though, just be really careful. Now, your post-procedure medications, so you'll have Panadine Forte, which is paracetamol and codeine. You're going to take 2 the night of the procedure, 2 the following night. I would recommend that you do take them, but it is up to you, just because as the anesthetic's wearing off, sometimes it can be a bit tender. Also, it helps you to sleep as well, and also your body's going to be recovering during sleep, so sleep's really important. If you are really struggling with sleep, we also give you temazepam just in case you need it, so that's a sleeping tablet. If you have any pain during the day, just take Panadol. You can take that every 4 to 6 hours. And prednisolone we also give to you, so you take 2 tablets in the morning after the procedure and 2 the following morning. That helps to reduce any inflammation. All of the medications labelled, but if there's anything you're not sure of, just message us. We also give you some antibiotics to start as well, just for 3 days. Avoid anything like ibuprofen for the first 3 days because it thins your blood and you don't want to cause any bruising. Sleeping, use a travel pillow and prop yourself up with pillows either side of you, slightly elevated, about 45 degrees. That will, one, help with the swelling, and also it will stop your head moving around too much in the bed, which could cause any friction against the grafts. So that is the first 3 days. After that, so from days 1 to day 10, you just want to be showering from the neck down, not super hot, not a high pressure. From day 3, you can use the baby shampoo. So you can use that. The best way to use that is if you fill up your sink with water, put a few drops of the baby shampoo in, make sure you've got lots of bubbles. And then with a cup, fill it about halfway, just pop your head over the sink, fill the cup up, and then just pour it over the grafts like this, just to clean them. So that's on day 3 or the 4th night if you're thinking about it in night. And then just dab off any excess. Again, make sure you're not rubbing. So that's the baby shampoo. Itchiness is normal. It's a sign that it's healing. Once the saline's been used, what you can do is you can just fill it with tap water, keep it in the fridge, and then if you spray it in the areas that are itchy, it can just help to relieve that itch. If it gets really bad, try Claritine, like antihistamine, which you can just get over the counter from Chemist Warehouse. Don't disrupt the grafts. If it's itchy or anything, just tap, don't scratch. No alcohol for the first 3 days either. Swelling's normal, normally happens around sort of day 3 to 4. What I would suggest doing is that with an ice pack in your freezer, just pop it over your eyes to help reduce the swelling, but not on the grafts, so just on the eyes. Numbness is normal. Takes a couple of months to fully come back sometimes, so don't panic. Mild headaches, like I said earlier, take regular Panadol. So that's kind of all of the main things from day 3 to 10. On day 10 is the day 10 hair wash. So that's when all of these scabs need to come off. So what you need to do is use this part of your finger. You can do it in the shower if you want, but just make sure it's not super hot and not a high pressure. And then you can just sort of with circular motion start to remove the scabs between day 10 and day 14. So if you don't get them all off on day 10, don't panic. If you're a bit nervous about doing it at home, you can come in and we can book you in for a day 10 wash here. So it's up to you, see how you go, but we're always happy to book you in. And then we can also see how you're getting on as well. A few do's and don'ts. Most important one is no exercise for 2 weeks, and if it's any contact sport, 3 to 4 weeks. You want to avoid things like chemicals for the first 12 weeks. Shedding's normal, so shedding happens around sort of 2 to 3 weeks to about 9 weeks. So the hairs that we've transplanted, those will shed and then they will sporadically grow back, so don't panic. The front takes between 10 to 12 months to come back. The crown can take about 18 months just because the skin's tighter, there's not as much blood flow, that kind of thing. A lot of information, so if you do have any questions, our phone numbers are on this section. So we've got a clinic phone number, our email, and we've also got our after hours phone number, or you can just contact us via WhatsApp if that's easier. Most important thing for the first 3 days, just concentrate on this bit.